So I'm happy to be here talking with Sanith Wijesinghe from MITRE and to talk a little bit about the role of data in improving experience for veterans. Sanith, please, good to have you, and could you tell us a little bit about who you are and what you work on?
Thanks for having me. So I lead one of MITRE's innovation areas called Agile Connected Government. We have 8 innovation areas right now, so this one is specifically centered on improving customer and patient experience. A bit about MITRE's innovation program. We are internally funded by MITRE, staffed and directed by our own folks, but it's an applied research program, so it's aligned to our sponsor mission goals. So most of our research has that operational mindset, trying to work back from those kind of key issue areas and then identify research questions to further the mission.
And specifically here, people know about Veterans Affairs, very large organization in the government. What is your relationship and MITRE's relationship with the VA?
So MITRE's had a strong direct work program with the VA for several decades now, and we support the VA across all of their mission lines. It's the Veteran Benefits Administration, Veteran Healthcare Administration, as well as the National Cemeteries. And in fact, when I first joined MITRE almost 8 years ago now, my first assignment was with the Veteran Benefits Administration, helping to support the modernization of their claims records, going from paper to electronic. So I saw very real front line, the struggles that they have, and it really helped influence the work I'm doing now.
So let me ask you about that, because particularly here we're talking about the veterans' experience. Mm-hmm. What types of outcomes are we working toward together with the VA for veterans, for those who've served before?
So improving veteran experience has for a long time been at the front of the mission for the VA. But in the recent past, it's become even more of a high-profile goal, given some of the changes in statute that we've seen, where veteran experience is now a compliance requirement. It's in the law. It's not a thing you can do on the side. And so with that, focus has become a need to really strive the operational side of VA to maximize those benefits to the veterans as well. So those two things oftentimes don't work hand in hand, because a lot of our agencies, including the VA, are very stovepipe. They maximize along business lines. And so you can see how sometimes the veteran experience, which might cut across all these different business areas, isn't quite optimized to serve those needs that cross-cut. So a lot of our research efforts right now are centered on how do we build those connections across the different business divisions.
Okay, and what you were going to be talking about at HIMSS and will be talking about in the future really is the role that data plays in being able to do that, to work mm-hmm. across the various parts of VA, right? How do you think data can change that experience, improve that experience for veterans?
So I think there's several different dimensions to the data here. To first order, there is a lot of operational data that the VA has that tells you, how many applications for certain benefits were, at what time in the year, and all of that kind of insight needs to be complemented by the experience data, which sometimes is a lot less quantitative in the sense, how well did you feel, you were served? Was it timely? Did you feel that, were you able to get the answer the first time around? So there's another set of data which isn't as easy to access. Some of those are available as surveys. Those are kind of structured surveys, but sometimes there are unstructured, unsolicited comments that you also want to be able to capture. So there's a real challenge to try and integrate all of those together, especially when the operational data is diverse and kind of distributed across all the different administrations. to be able to kind of thread the line to a specific veteran, starting even way before they even make an appointment, trying to understand the context behind what else might have happened to them prior to that point in time. It's a real challenge, both on a policy perspective, because sometimes you may not be able to share the data for various reasons, especially with healthcare data. It's a operational challenge just because of the distributed nature of the data, and then it's also a challenge on a research front, knowing how to do that integration once you have the data.
Because you may have some qualitative and quantitative measures, right? You
Exactly.
want to give them the proper weight to come up with the right conclusions from them.
Absolutely.
And this starts even before a veteran may become a veteran, right? They may be transitioning out of active duty or retiring and getting ready to transition, and we want to help make that as smooth as possible.
Absolutely, and actually you touched on a really key point, which is, with MITRE's ability to work cross FFRDC, we have a unique vantage point to see this problem starting from the DoD side. And one of our research efforts is to try to do that cross-agency integration from the DoD health records to the VA side of the house. How can we take advantage of that early insight to potentially anticipate some of the problems that might emerge? So right now we have a research project working with the VA's CDO, Chief Data Officer, to try to help bridge those connections and in fact go to a stage where perhaps it's even pre-enlistment and try to build this journey for that veteran, looking at the experience they have during their military career, all the way through transition and then through to benefits and services downstream.
How does this work then when you have a population coming out of recent combat, where you may have higher instances, as we know, of traumatic brain injury or PTSD, those kinds of complex health challenges? So
that's where some of the data analytics can try to come into play. The statistics bear out, the issue here, where a lot of times, especially with respect to veteran suicide, the statistic you hear about, 20 suicides per day, a good 2/3 of that are folks who are not even in the VA system to start with. But how could you potentially identify them if, for example, you had their DoD records in hand? You might be able to figure out who might be at high risk, who should you reach out to in advance. So the data analytics provide you a lens through which to do a bit more of the anticipatory side of this service, rather than just kind of treat it downstream. How far left of this event can you go? And then you can, from that data, put into place ways of, say, getting people into the VA system in higher percentages, and therefore have more services, more. Exactly. And then you can start to be a lot more strategic about what are the best intervention points. In terms of particular outcomes, can you figure out the service model around it that isn't just served by Veteran Health Administration, but how does it work with the VBA? What might be the guidance at the transition program stage? So all of that becomes more of a optimization that's informed by some kind of underlying empirical evidence. I want to ask you just to speculate a little bit or look forward to where we hope to go. What would be a realistic future state? A couple of years down the line, what's the reachable goal, or really the desired goal in terms of using data to improve that experience? If we could really work hard at it and continue the good relationship that we have with the VA. So one of the big changes happening now with the VA is with the Mission Act, which is moving to a community care model. So it's not just the VA that's providing veteran health services, it's now a collaborative community effort. So you may get care from a VA hospital, but also from a private
clinician and
Yes.
in other settings.
So when you look at future state, that's a different service model which requires a different operating paradigm, given that maybe VA may not be the single source provider for services. There's a question then on what's the right mix of services that we should provide, who can do that best and at the most cost-effective manner. So there's a need to try to look at what the best efficient kind of posture is while maintaining the same care and kind of commitment to service that the VA is known for. And balancing those two things, I think, is going to be the challenge looking forward. The data will hopefully provide kind of the framework in which you make those decisions, and I think it plays to MITRE's strength here in our work in modeling and simulation, optimization. All of these things can be brought to play in envisioning what that future state needs to be.
And I imagine that there are a lot of differences based on rural versus urban and geography and population density and those kinds of things.
Absolutely, and maybe for those very hard to reach populations, we need innovative out-of-the-box solutions as well, and that's where our innovation program comes in to try to help brainstorm how do you bring the services to the population rather than having them travel hundreds of miles to a hospital.
Very good. Well, thank you very much for joining us today and talking about this work, and good luck with it as you continue.
Sure.
We
Thank
look
you.
forward to seeing what happens.
Thanks for the time.
Thank you, Sanith.